So what keeps me coming back, or what will keep me coming back, because this is my first conference, is that I find an amazing range of people here coming from a very wide range of very interesting organizations, public and private, all having very unique and different experiences of implementing value-based care. So for me, it's the only gathering anywhere where one can get that exposure. I think what I've learned new from this ICHOM 2023 conference is actually the difficulty that many of the participants are experiencing in scaling value-based care into their environment. So many people are talking about pilot projects. There's numerous interesting pilots, but people just generally are really struggling to take those to scale. And that's been quite an important takeaway, and I think important to think about, how to overcome that. Vitality Health International operates in health insurance in several countries. We were born in South Africa, where we still have the largest health insurance organization, and it's there that we've done the most on value-based care. We have led the market there in private health insurance, brought all of the major providers into contracts with us. We've been at it for almost 15 years now, so there's a lot of learning, there's quite a lot of trust has been built up. And I think there's an important role for an organization or two, whether public or private, to take the lead in these kind of initiatives. I think that all of us in this community are aware that we're onto something very important and very necessary for the future of healthcare. And I think broadly that message is landing among policymakers and leaders. I guess the key challenge for all of us is, how do we overcome what are very real, very serious obstacles to go from, okay, now everyone gets it, to everyone's ready to implement at scale. And I think there are lessons that we can learn, but that seems to me like the key issue we need to think about. For ICHOM itself, I think it has a critical role in lobbying, both policymakers and private corporate leaders around the world to say, this is what's necessary. Here's some examples of how it's getting done. And by the way, here's some standardized data sets that you can use. I think my message for ICHOM is that its role is ever more critical. It's more critical now even than when it started 10 years ago. I think ICHOM's in a way, got to base camp, which is value-based healthcare is known around the world. Everyone appreciates the importance of it. I think the data sets are there in the main and great progress. I think the message for ICHOM now is how can you help all of the constituents of ICHOM, to start climbing Everest, move off base camp and start overcoming some of the obstacles.